If you're one of the millions of Americans who struggle to get enough sleep, there are important things you should know before turning to a pill or potion. Back this week with some solutions is Dr. Jenny from ageVital Pharmacy. I just can't wait to see you every week to hear what we're going to talk about. So today we're going to talk about insomnia.
Yes, insomnia.
Which so many people have problems with.
It's the #1 thing right now, insomnia, and it's not just plaguing an elderly population, it's plaguing the youth as well. And that should be horrifying to most people. Why are teenagers not able to sleep well? Why are college students not sleeping well? And remember, we talked about stress in our environment, in our adrenal glands, some of our other segments.
They all tie in, right?
Everything ties in together, and you go to your doctor and they want to give you your Lunesta or your Valium, or they give you all of these neuropsych medications that damages the prefrontal cortex of the brain, yes, damages the basal ganglia. It literally, Nancy, rewires your brain. So you're taking supplements that are neurodegenerative as opposed to neuroenhancing, and that's something that you don't want to take that. Well, it's like, give me something that's an actual chemical that's going to help me with sleep.
Chemical, but natural.
Biochemical individuality. Okay. Like, remember I told you I don't like the word organic, right, and I don't even like the word natural, yep, because things can be natural, right, but not natural to our body.
Exactly.
So I love biochemical, okay, biochemically identical, I think is the word that I'm coiling.
I like it.
Yep.
I like
so
it. Okay.
what is in my body that's causing me to have insomnia? To not be able to, my brain tell me, lights out. And I've struggled with that. I have 4 kids, my goodness, and it seems like after you have baby #1, it's downhill from there, because you're up and then your sleep cycle gets messed up.
Never sleep the same again.
I had to test myself for deficiencies. So, okay, how do I get my sleep cycle back? How do I dream? How do I have that recuperative, regenerative sleep again?
So how do people? What are the treatments?
Yeah, once we test, you can do a blood spot, you can do saliva testing, you can do urine testing, and you can look for chemicals in your body. Magnesium. This is something your body will naturally, pull out of foods, and your body can utilize it. It's a neuro de-excitatory nutrient, I call it, because it tells your body to calm down. So magnesium is very calming. It's great for autistic children too. This is what calms autistic children down when they're so anxious and nervous.
That's so interesting.
You take that right before you go to bed. Do a tablespoon or a teaspoon of that right before bed. Oh, your brain just tells you, lights out.
And you mix that in water?
Yeah, you mix it in water.
Juice?
I have it in a syrup form. I have it in capsule form. I have it in a suppository form. Just depends on the person. Everyone's different in how they want to take it.
And if they come to your pharmacy,
we'll assess, and we give them their options.
Okay.
CBD, the non-psychoactive ingredient from the cannabis plant, that's huge right now.
Now, you mentioned this on another program. So this crosses a lot of...
Yes, because it helps. It's an antioxidant. And if you have inflammation neurologically that's blocking certain chemicals from making that, from converting into something called GABA or melatonin. Everybody knows what melatonin is. So you want your body to get rid of that inflammation.
So when you talk about CBD oil, is it the same one for insomnia as it is for other issues that you may have?
Yep,
or there's
different concentrations.
There's different concentrations.
Yep, you usually have a 500 milligram or 1,000 milligrams or a 2,000 milligrams, and everybody's different in how much they need. And you have a full spectrum and a broad spectrum. So a full spectrum has the less than 0.3% THC, so it actually has a small amount of the THC, just enough to be considered industrial cannabis. So the industrial cannabis is what's considered hemp. So CBD in essence is hemp. Cannabis is hemp.
Well, and it's a natural.
It's a plant.
It's a plant.
Just like asparagus, just like kale, just like spinach, all of these wonderful whole foods.
They have hemp milk.
Yes, and it's so good for you. It's such a great source of proteins and vitamins and essential fatty acids. So anything that has fatty acids in it feeds and nourishes our body. So just like kale and spinach. So cannabis plant should be labeled as a whole foods. I tell people you can eat it like a salad.
There you go.
And put tomatoes and cucumbers. Put in your salad. It's really good for you. Now this is a supplement that I formulated. It's called my GABA Dream. Now, my GABA's got a combination of magnesium, the melatonin, the theanine. These are all neuro de-excitatory amino acids and vitamins. So it's a good combination of everything, where if you're not quite sure what you're deficient in, this just makes people calm down. I take 2 capsules of that, especially if I'm up late and I'm writing papers, or, the little one is keeping me up and I have to keep going. My 3-year-old, my goodness, she makes me an insomniac because she wants to hop in my bed. So, yep, I take 2 2 of those, and oh, I feel so good. And you wake up replenished.
What is in this?
Theanine, which is an amino acid that calms your brain cells down. It's got magnesium, it's got melatonin, and it's got an amino acid called GABA. The GABA amino acid really helps calm your brain waves.
And this we've seen before.
L-glycine, it doesn't require a script, but like I said, everybody needs a different amount, so I do put it under a prescription. They can just come in and get it. The pharmacist can write a script for that. L-glycine is the smallest of amino acids, Nancy, but what it does neurologically, it just helps you calm down, really gives you that super calm feeling, because that's really what you need, is you need something to tell your brain, it's time for you to go to bed.
It's time to go to bed.
And to make all that noise. Insomnia is noise, neurological noise, where you're thinking. And women, we can't turn our brains off.
Yeah.
Okay, we can't go to a nothing box like men do. Men can go into a nothing box. When I ask my husband, what are you thinking? He says nothing. He means nothing. Men are all like that. We don't have that superpower.
That's so funny.
We need chemicals to do that.
Funny. So this is the type of thing you will test for at your pharmacy.
Yes.
And one of these products you would recommend?
Yep, or they can come right in with even without testing. If they're having sleep issues, I recommend any of these supplements and it'll work. The GABA-amine is a good place to start, the GABA Dream. So, yep, once they're done, when they come in, they're like, oh, I had my first night's sleep in a long time.
And if it doesn't work, then they might want to do a little bit more.
Then they could do a little bit more investigative work, because sometimes it could be related to hormones too.
All right.
So
great. Thank you again, and we'll see you next week.
Thank you, Nancy.
Esther Holt with Star Financial joins us after the break, so please stay with us.